Dr Azad Moopen launched his first clinic in the GCC 22 years ago, and as the chairman of Dr Moopen Group, has gone on to build one of the largest networks of private healthcare facilities in the UAE. We spoke to him today at the Medcare Hospital to find out how the healthcare industry has been affected by the global credit crisis. Well, thank you so much for joining us here today.
Thank you.
Now tell us, how has the healthcare industry been affected by the global credit crisis?
Luckily, we are not being affected significantly. In fact, we are not affected at all. What we have found is that we have been on targets regarding patient numbers, procedures, the financial performance. Whatever you look at, we have done as per the what we planned. There has been a very slight effect in some sectors, which has been compensated by increase in other sectors. So on the whole, if you look at UAE or India, where we operate, and other GCC countries, we have found that it has not been affected. And healthcare is something which, according to everybody, is affected the last and the least, which we have experienced here because it's not at all affected actually.
Absolutely. No matter what happens, I think people keep getting sick, need treatments, have children.
True.
Now, what about the Moopen Group as a whole? How has that been affected?
No, as a whole, the group has done extremely well here as well as back home in India. Here, as I told you, it has been above targets. Most of our businesses have done extremely well. So the patient numbers, the collection per clinic, or whatever sector you take it, it has done extremely well. And the only sector which is slightly affected, if you take the overall picture, was the segment which was catering to the construction industry, which is slightly affected. But luckily, in other areas, there has been a growth and it has been compensated.
We're here at the Medcare Hospital, which opened 2 years ago. What prompted you to open the hospital to begin with?
Medcare has been a great success story. In 2 years, it has become one of the premium hospitals in Dubai, and the patient flow and all has increased tremendously. And the reputation, we are happy that people are very happy with the services here. And the decision to have it here was, this area didn't have, the Jumeirah area didn't have a good hospital, and we thought that we should fill that gap, which did very well. We are the preferred destination for people in Jumeirah and the new Dubai developments now.
You focus on high-income patients here. How do you do this?
Yeah, see, the tariff itself, does that selection. If you look at the tariff that we charge here, which it's comparable to the few of the premium hospitals in Dubai. And we have other hospitals which are having a lower tariff catering to the middle income population. So there is a selection by the people and also by the insurance companies. So the service levels here are much higher, the ambience and everything is at a much higher level. So people tend to come to places where they can get that service and the ambience.
So how do you balance profit and patient care?
See, we have always felt that profit should be a byproduct in healthcare rather than the aim. So that is our motto, and which has helped us a lot. We never look at profit as the primary requirements in healthcare industry. It has to be patient care, patient care, patient care. And when you do it properly, profits will come as a byproduct. That's what we do here also. We take care of the patients, we take care of their illness, we take care of their emotional issues, we take care of their requirements, and then profits come in. We have done extremely well financially. In 1 year, we went into a profit, and we have done well. Not because we targeted on profit, it's because we did what we have to do to take care of the patient.
The UAE is currently expanding its healthcare facilities in order to appeal to international travellers. Do you think we should be focusing on these health tourists? I know that India and Thailand are popular destinations for this at the moment.
I think there's a huge potential for UAE and Dubai especially to develop into a healthcare tourism hub. People from the Middle East, other countries, prefer to come to Dubai due to several reasons. And this could be one additional area where you could attract people to Dubai, people who are going to Western countries now, to Europe or to the US, or people going to the Far East in search of healthcare requirements. I think they will all love to come to Dubai because there are a lot of advantages. One, they need travel less. Second, the cultural, the similarity they have when they come from the other Middle East countries. So, and the cost-wise also, I think it is comparable or even less than what you have in other places. So, I think Dubai has huge potential to grow into a healthcare tourism. We already get a lot of patients coming from other GCC countries to Midcare Hospital. And I'm sure once Dubai Healthcare City and all is operational, there will be a large flow of patients to Dubai from other countries.
A new report from Alpen Capital says that the Gulf healthcare industry is expected to total $55 billion by 2020. What do you think their biggest focus needs to be?
I think the most challenging thing to be fulfilled is the HR issue, the inability to get trained and qualified healthcare professionals. It's the most important issue. So I think that the government should focus on having more of educational institutions addressed to the healthcare issue, like the medical colleges, nursing colleges, other institutions, which should increase the number of locally available healthcare professionals. Now, most of these people, especially in the nursing and other paramedical staff, are being imported to most of the Gulf countries, which should stop. There are a lot of girls and boys who could be trained into good healthcare professionals. And I think that should be the focus of the authorities, to look at the healthcare HR requirement and give training to the youngsters so that they take up this as a profession.
Yes, training our future generation here.
True.
Of course, you've worked in the industry for about 22 years now. How has it changed over the years?
No, if you look at UAE, where we are most active, of course we are active in other GCC countries too, there has been a tremendous improvement in the healthcare delivery system, both from the private sector as well as from the government sector. The one important thing that will make a huge difference, and which has already made some impact on the healthcare sector in GCC, is the insurance. Now, earlier it was a huge issue, who has to bear the bill, and especially all the expats who are coming here, it was a huge issue. Now, many of the places, like Abu Dhabi, it is 100% now, and Dubai and all is coming up, and other GCC countries are also planning healthcare insurance to cover at least the people who come here, the expats, to be taken care by their employers, will produce a huge change, huge impact on the healthcare industry as a whole.
Well, some very interesting insights there. Thank you so much for your time today, Dr. Moopen. It's been a pleasure.
Thank you. My pleasure. Thank you.
Well, that's it for this edition of Inside Business. You can contact us by writing to ib@city7tv.com. You can also join the Inside Business Facebook page. But for now, from all of us on the business desk, goodbye and thanks for watching.